Sorry, that cut out. I accidentally hit the stop button. But yeah, every time they tried to pull back blood, the valve would cover the vein and no blood would come out and it would hurt really bad. So wait a few hours while that's kind of hurting. I mean, it's not like the worst pain I've ever felt, but it wasn't comfortable, that's for sure. Different nurse comes in, tries a couple times, doesn't work. So she calls in the doctor. Because apparently ER doctors are supposedly trained on ultrasound machines to put in IVs. I didn't know that. I didn't trust this doctor from the moment he came in my room. He did not seem put together. He did not seem confident. I was worried. Like, I have already had 3 panic attacks at this point because of needles and stress. I didn't want a 4th. I got a 4th. But, and it was the worst of all of them because my nerves were shot. So, he put an IV, hold on, here. See all that bruise? Hang on. Ignore the other IV, that's not important right now. But see all that bruise? Yeah. That IV was in my arm for 20 minutes. And it bruised like that, if that tells you how badly he did. So, while he's putting in the IV, after I told him I have post-traumatic stress disorder that is triggered by needles, and to please be as gentle as possible, and, tell me when he's going to stick me and all that stuff, which he did do that. Not enough. But, yeah, so he knows that I have problems with needles. Cool. He decides to tell me that he's never done this before. This is his first time. And then proceeds to back up that statement by needing so much help from the nurse that I'm pretty sure she just should have done it herself. She probably would have done a better job. It was hurting the entire time. I told him it was hurting the entire time. I told him it did not feel right. I told him it should not be there. I told him it wasn't going to work. He didn't believe me. So he placed it anyway and put the tape over it and left the room. Within 3 minutes, it was hurting so bad, it had triggered my panic attack, and I was in tears. Another reason I was in tears is because I could not reach my call light. So I couldn't tell anyone that my IV was on fire. I was pissed. So I just started yelling. Took me about 5 minutes of yelling to get somebody in there. So 20 minutes total of having that IV in my arm. And I said, take this out of my arm right now. And they did. And it bruised all to hell and back. I don't know how well that video was of the bruise because I wasn't able to see the screen. I should have just flipped the phone, but I didn't think of that at the time. So whatever. Not long after that, the VAT team finally showed up. Now, I'm pissed that they've taken 7 hours to get there. But I also understand that they're the only VAT team for this hospital. And they also do University Hospital. They're the only team across 2 hospitals. That's not really their fault. I blame upper management for that. But anyway, they placed this beauty. Yay. And I can't feel it at all. And it draws back blood and accepts medicine. Instead of doing one of those things and not the other, which is what the other 2 IVs did. Because they were able to get blood out of the IV that blew super fast and needed to get out in 20 minutes. Not much, but just enough to do the lab work that they needed at that moment. But it wouldn't accept medicine. And drawing the blood hurt, which drawing blood from an IV is not supposed to hurt. Putting medicine through an IV is not supposed to hurt unless it's certain medications. And they usually warn you about those. Like, hey, this burns sometimes. Okay, great, thanks for the warning. Saline's not supposed to burn. That's all they tried to put through it was saline, and it hurt like fire. Which I know I've used that analogy twice now, but whatever. Anyway, so that sucked. I ended up going up to floor 7, after that to the transplant unit where I always come. And I told them my biggest concern right now is these migraines. Because the migraines are causing the nausea. I can almost guarantee that. And my stomach is in knots. But I've had a migraine for 5 months. So maybe that's the reason. Also, they've recently changed my diet. That has to do with endoscopy. I'll get there in a minute. But yeah, so I told them migraines are my top priority. So they finally ordered me a consult with a neurologist. The neurologist has fixed things, at least enough for me to be okay with it. She ordered me what's called a migraine cocktail, which is like a specifically made like set of medications that are supposed to help combat a certain thing. In this case, migraines. They gave it to me last night when I had a pretty bad migraine, and it helped, but it wasn't the full cocktail. It was missing a piece. So, and they gave me the weaker version of one of the meds that's in there, and the neurologist today said that they're definitely going to not do that again. So, okay. So I should get the stronger version of that and add the third medicine, because there's 3. Add the third medicine on to the next time I have a migraine, and I feel one starting again. It's at about a 4 out of 10 right now. I'm expecting in a couple of hours it'll be at like a 6 or 7. That's when I'm going to order the migraine cocktail, because I know at that point that it's gonna hit a 10. So, okay. She also, this neurologist, figured out almost 100% likely what's causing my migraines, which is a combination of 2 things. 1, Prograf can cause migraines. I hear it's not like the most super common thing, but they can cause migraines. Or it can cause migraines. Well, I have to take Prograf for the rest of my life, more than likely, because it's a really good anti-rejection medication for transplant patients, especially lung transplant patients. So I'm not going to avoid that anytime soon. So they're just going to have to treat them instead of trying to get rid of them. Also, my stress level. I'm super stressed, guys. I don't look like it right now because my headache's been gone for most of the day, and that kind of put me in a better mood. Not a perfect mood by any means, but a better mood. But yeah, lots of stress. They're trying to get my stress under control. The neurologist actually has told the transplant team that they have been neglecting my psychological stuff, and they need to make that a priority now because these migraines are not going to help themselves. And psychological help will help with the migraines. So, or at least in theory should. Now, the endoscopy. That was done. Okay, an endoscopy is when they go down your esophagus with a scope. Scope, get it? Okay. And I think endo means through the mouth, but I'm not positive about that. But they go with an endoscopy through the mouth down into my tummy to look at my stomach and see what's going on with it, if there's anything abnormal, because my gastroparesis is not reversing as well as they had hoped. And they went in, checked that out, did what's called an endo flip to see if the muscle of my stomach was responding appropriately. I guess it wasn't. So they injected it with Botox. Apparently Botox can help unparalyze the stomach. So after the endo flip and the endoscopy, which literally only took like half an hour, so no big deal there, they changed my diet, sort of. They said tentatively you can start eating solid foods again, but low fat, low fiber. We want you to follow up with your dietitian and ask them what to do. Well, I didn't get a chance to follow up with the dietitian before I came to the hospital. So they sent me a dietitian while I was in the hospital. And she gave me, let me get this stuff off my thing. She gave me this, which is a low fat, low fiber gastroparesis diet packet. I can eat solid foods again. Not all of them and not much of them, but I can eat them again. I had salmon for dinner last night. Yeah. No, 2 nights ago. My apologies. But yeah, so that's exciting. Super exciting. That was a major stressor in my life, was only eating period foods. And if I wanted a solid food, I'd either have to deal with it or sneak it and then get a lot of stomach pain. The first couple days after I started eating solid foods, my stomach was completely destroyed. It was like, what are you doing? We haven't had solid food in 4 months. But it handled it. It's over it now. I've had solid food for the past few days, and it's been fine. So, not too worried about it at this point. I've just been gassy. And I still have a little bit of, sorry, TMI, diarrhea. But, I've had worse, so I'm not that worried about it. It's not causing me extreme grief, so whatever. But yeah, status update on the hospital stay. And I am so sorry that this video is like 30 minutes long at this point, probably. But status on the hospital update. No, I don't know how to speak. Update on the hospital status. I'm supposed to leave tomorrow. So today is, like I said, St. Patty's Day. It's Wednesday. I told the doctors I had to be out of here before Friday. Like, no questions asked. Had to be out of here before Friday. I'll get to why in a minute. And they said, well, we'll get you out either Wednesday or Thursday. Well, it's nighttime, as you can see. It's nighttime on Wednesday, so I'm getting out tomorrow. They told me that earlier today. Probably tomorrow afternoon sometime, probably 1 or 2 would be my guess. That's usually when they discharge me from here. But yeah, so they're going to do that, and I get to go home. So Friday, we signed papers on the new trailer. I think you guys might remember, if you rack your brains, that we were trying to get into a new trailer in December. That still hasn't occurred. For lots of reasons. I don't remember if I've talked about them before, but nobody cares about the reasons right now. I'm just going to say it's taken a hot minute. We're finally getting it settled, and we signed the papers on Friday, which is 2 days from now. So then we can start moving in as soon as possible. Now, that being said, we have the kids for about a week after we sign those papers, because we picked them up on Friday and we're not taking them back until the 24th because Harmony has spring break and we get her for half of that. Okay, cool. 25th, we're moving. So we're thinking about hiring movers. I've got all of our March bills paid up and a credit card paid off because of the stimulus. So I'm going to try to allocate some money to actually getting movers as well. But we'll see how that goes. So, yeah. Anyway, I think that's all I have to say right now. I'm hoping to stay out of the hospital for a while because I'm hoping this will control those migraines, and the voriconazole is controlling the fever as far as I can tell right now. I'm not even sure if the penicillium is still there because they didn't biopsy or bronch me this time. So, because I didn't have a lung concern, I had stomach and head concerns. So, whatever. All they did was like a normal chest x-ray, which at least the pneumothorax is definitely gone. I mean, it was pretty much gone the last time I was here, but it's definitely gone now. But yeah, so I will talk to you all later. I don't know why I'm hyper today. I'm kind of enjoying the change because I've been so freaking depressed since like November that it's been stupid. But whatever, I'll take a hyper day. But I'm afraid I might not sleep tonight because of it. Not that I've been sleeping a night anyway. But, yeah. So, until then, see you later.